Good morning, everyone. I'm Jo Wilson, Cancer Survivorship Nurse at Latrobe Regional Health. Today I'll talk about the LRH Survivorship Clinic. Our clinic is well established and in its 8th year. The Cancer Survivorship Clinic is part of the initial Cancer Shared Care project, which commenced in 2017 and was funded by the Victorian Department of Health. A major component of the pilot program was to develop specific models of shared care in Gippsland, Western Victoria and Murray regions, with Gippsland the overall lead. Participants were recruited from 3 sub-regions of Gippsland, Central, South and East, as these regions represented the largest population of cancer patients. Participants were eligible if they had completed adjuvant cancer treatment within 12 months for breast, prostate, colorectal or lymphoma tumour streams. These streams represented the largest survivor groups in the region. Referrals were accepted from specialists and nurses. Genitourinary and skin cancers also had been identified among the most common types of cancer in Gippsland. The clinic expanded referrals to include gynecological and melanoma tumour streams. The shared care model was developed collaboratively by clinicians, primary care providers from the region and consumers. The goal was to create a clinical framework that ensured cancer survivors have access to ongoing, high quality and equitable cancer care, regardless of their location or where they received treatment. The clinic was staffed at LRH at 0.4 EFT. Clinic appointments were offered face-to-face and involved 2 appointments 4 weeks apart. During COVID, the clinic moved to a telephone-based contact model. Currently, the Cancer Survivorship Clinic is staffed 0.6 EFT at Latrobe Regional Health and 0.2 EFT at Bairnsdale Regional Health Service. Keeping referrals flowing can be challenging, and the clinic expanded referrals in 2024, becoming more inclusive. Our model of care remains the same, however is now inclusive of all cancer patients regardless of treatment intent and stage of disease, and all members of the MDT are welcome to refer. We cover all Gippsland hospitals and local government catchments except South Gippsland, which established a successful survivorship clinic service in 2024. Our main sources of referrals are radiotherapy nurses, chemotherapy nurses, surgeons, pharmacists, cancer care nurses at LRH, and McGrath cancer care nurses and prostate cancer nurses within the region. Self-referrals are often received from consumers who reside in Gippsland but have received treatment in Melbourne and the metro area and would like local support. Our most common referrals are for breast cancer and prostate cancer patients. Our current project is the Gippsland Survivorship Network Pilot Program. This pilot aims to integrate McGrath Foundation breast care nurses into the Latrobe Regional Health Survivorship Clinic, addressing gaps in breast cancer survivorship. The project highlights regional challenges by improving access to a survivorship resource through a collaborative approach with the McGrath Foundation and supporting the clinic in its goal to extend survivorship care to all tumour streams. Survivorship nurse clinic appointments can be face-to-face or by phone depending on patient preference. It took time to re-establish our face-to-face contacts post-COVID. However, phone appointments are more suitable for some consumers for a variety of reasons, including distance from the hospital, mobility and transport requirements. I endeavour to coordinate the survivorship clinic appointment with any oncology review appointment the patient has, to make accessing survivorship more convenient and prevent extra travel time for patients who live further away. Face-to-face appointments are for 1 hour. During that time, we discuss the patient's diagnosis and treatment and ongoing side effect issues. Health and wellness is addressed and follow-up care is scheduled to ensure that consumers know the next steps in their care. The supportive care screening tool is completed to determine any new supportive care needs and appropriate referrals are made. This is followed by a phone call in 4 weeks to check in and confirm the contact status of referrals. Telephone appointments consist of 2 telephone calls 4 weeks apart. The first call covers the diagnosis and treatment components, and the second, health and wellness and follow-up care. If referrals are made, this is followed up again in 2 weeks. All patients are encouraged to contact the survivorship nurse between appointments and after they complete the survivorship nurse clinic to ensure another point of contact and continuity of care. The clinic allows for a full hour to engage with consumers. We have the luxury of time. As well as completing the treatment summary, care plan and supportive care screening tool together, the appointment allows an opportunity for the cancer survivor to revisit any aspects of care that they found challenging and debrief. For those on maintenance treatment, we ensure a regular supportive care check-in to determine any changes in needs. Supportive care is always extended to family members and carers. Thank you for the opportunity to present today. If you would like any further information about our clinic, please contact me.